Welcome to this explainer. Today, we are going to completely flip how you think about your own health. Seriously, we're diving deep into some absolutely fascinating medical insights from Seoul National University's Professor Lee Seung-hoon. Together, we are going to systematically dismantle some massive health myths that have probably been confusing you for years. So let's jump right in. Let's kick things off with a pretty wild question. Why is the hospital actually the absolute worst place to check your body's most important vital sign? I mean, you'd think a doctor's office is the perfect setting, right? Well, wrong. According to Professor Lee, just stepping foot inside a hospital triggers this subtle stress response. Your body instinctively cranks up your blood pressure to stay alert. If you base your health entirely on that one artificially spiked hospital reading, man, you might end up over-medicated for a problem you don't even have in your everyday life. Now, to understand exactly why our bodies react that way, we've got to tackle another huge misconception. Because before we go labeling cholesterol as the ultimate bad guy, we really need to grasp a fundamental biological truth. Without it, a person literally dies. It's a vital survival nutrient. It makes up the membrane of every single cell in your body. It is definitely not an automatic villain. It is the very foundation of your cellular health. So we constantly hear about good HDL and bad LDL, right? But here is the fascinating secret. They aren't inherently good or bad at all. Because blood is water-based and cholesterol is fat-based, they just don't mix. Your body uses these lipoproteins, which act kind of like soap-like surfactants, as tiny delivery trucks. LDL is just the truck delivering cholesterol to your body, and HDL is the truck retrieving the excess. They are carrying the exact same substance inside. We literally only call LDL bad because it's actively dropping off cargo that can sometimes pile up in the wrong places. And this brings us to a massive myth. You might think eating a giant steak is what spikes your cholesterol, but get this, 80% of the cholesterol in your blood is actually synthesized directly by your own liver. Yep, 80%. Only 20% comes from your diet. And here's the real kicker from Professor Lee. Your liver often synthesizes that cholesterol using the carbohydrates you eat, not just the fats. This is exactly why just cutting out meat doesn't magically fix high cholesterol for most people. Section 1, Statins and the statin phobia phenomenon. Let's see how this biological fact builds into one of the most controversial topics on the internet right now, cholesterol medication. To really understand statins, we have to look back at the history. Back in the 1950s and 60s, early cholesterol drugs were actually pretty dangerous because they haphazardly blocked absorption. But then, in the 1970s, a Japanese scientist made a massive breakthrough and invented the first statin. Instead of blocking absorption, statins tell the liver to stop synthesizing so much cholesterol from carbohydrates. By the 1990s, thousands of clinical trials proved beyond a shadow of a doubt that this dramatically lowered the risk of stroke and heart attack. Looking at the clinical consensus impartially, statins are considered an absolutely monumental medical discovery. Yet despite this proven track record, we are seeing this massive wave of statin phobia. It's a largely internet-driven phenomenon causing totally unnecessary fear. Now, do statins have side effects? Well, yes. Some patients experience minor muscle aches because the medication alters synthesis in the muscles too. But the absolutely crucial point is this. For high-risk patients with growing arterial plaque, these minor side effects pale in comparison to the drug's monumental success in preventing deadly arterial sclerosis. For those who truly need it, it is literally a lifesaver. Section 2, the silent truth about high blood pressure. Now that we've cleared up the great cholesterol debate, let's tackle an everyday threat that is notoriously misunderstood. We've all been lectured about this at the dinner table, haven't we? You've probably heard that salt directly causes blood pressure spikes through water retention. The logic seems sound. More salt means more water in your blood, which means higher pressure. But is that really the full biological story? Well, according to Professor Lee, no, it's absolutely not. Your body is actually incredibly good at maintaining a stable sodium-water balance. The real culprit is much more fascinating. It's called a catecholamine reaction. When you eat highly stimulating foods, and get this, it includes not just salty foods, but ultra-spicy and overly sweet foods too, your brain registers this intense stimulation almost like a physical attack. It tricks your body into a literal war state. To prepare for this imaginary battle, your body spikes your blood pressure to send emergency blood to your tissues. It's the intense stimulation, not just the physical salt, that really drives everyday blood pressure spikes. Which brings us to a highly dangerous misconception. High blood pressure is completely symptomless. Waiting for a headache or a flushed face to tell you your blood pressure is high is honestly a fatal mistake. Blood pressure spikes are an intentional response by your body to deliver blood. Because the body is doing it on purpose, it does not send pain signals. You will feel absolutely nothing. If you have a headache, well, it's just a headache. The silent nature of high blood pressure is exactly what makes it so terrifyingly dangerous if left unchecked.
Section 3. Demystifying strokes. Spotting the real danger. What happens when these silent risk factors finally reach a breaking point? Let's demystify strokes.
When we say the word stroke, we're actually talking about two very different battlefield scenarios in the brain. A brain infarction happens when thickened vessels finally block completely. The blood stops flowing and the brain cells quietly die off. A brain hemorrhage, on the other hand, is violent. A weakened vessel literally bursts under high pressure, flooding the brain with blood. So while an infarction is a quiet blockage and a hemorrhage is a violent burst, both ultimately result in the tragic death of irreplaceable brain cells. And hemorrhages carry a terrifying 40 to 50% mortality rate. Because strokes don't have standard warning signs like a ringing ear or a bad migraine, you cannot just rely on feeling unwell. Instead, you absolutely must memorize the FAST method: face drooping, arm weakness, speech difficulty, and time to call emergency services. This is the crucial, scientifically backed, step-by-step method to identify a true stroke as it is actively happening. If you see these signs, you don't wait to see if they pass. You act immediately. Section 4. After the stroke, the reality of recovery. If the worst does occur, how does the brain actually cope? And how does it heal itself afterward? Okay, this is one of the most incredible biological analogies I've ever heard. Because dead brain cells cannot regenerate, recovery relies entirely on the cells that survived. Imagine an office where an entire department is suddenly fired, but the work still needs to get done. So the healthy, competent neighboring departments have to slowly learn to take over the heavy workload of the missing employees. That is exactly what your brain is doing during physical therapy. Surviving neurons are frantically rewiring to take over the jobs of the damaged ones. This reality of the recovery process is known as the rule of quarters. Yes, strokes are terrifying, but let's look at the bright side here. 25% of patients fully recover to the point where even they don't notice it. And another 25% recovers so well that others can't notice their symptoms. That means a full 50% of patients can return to normal or near normal lives within a few months. That is, of course, provided they receive prompt medical treatment and really put in the hard work of rehabilitation. Section 5. Simple habits for complete prevention. But let's be honest, the absolute best treatment is the one you never need. Let's transition away from the hospital and look at the simple, everyday habits you can use to prevent these events from ever happening in the first place. Forget about extreme internet diets or complicated workout regimes that you're just going to quit after a month anyway. Professor Lee outlines the absolute minimum medical actions you need to take. First, simply maintain your current body weight. Just stop it from increasing. Second, get a yearly HbA1c test to check for diabetes. Third, get a yearly LDL cholesterol check. And fourth, measure your blood pressure yourself. If you casually track these numbers just once a year and keep your weight stable, you are building a massive fortress around your cardiovascular health. And coming right back full circle to our very first question, since the hospital causes those artificial spikes, here is exactly how to do it at home. First, sit and rest comfortably for 2 full minutes. Do nothing. Just breathe. Make sure your arm is supported at heart level. Then, take a measurement. But here is the pro tip. Discard that first reading. You might still be slightly tense. Wait a moment, press the button again, and use the second reading. That right there is your true resting blood pressure. As we wrap up this explainer, I want to leave you with a final thought. We are constantly bombarded with misinformation out there, from statin phobias to salt myths. But the truth is incredibly empowering. Protecting your brain and your heart doesn't require panic. It just requires a bit of knowledge and a few simple scientific habits. So, will you let internet fear dictate your health, or will you take control with facts today? The choice is entirely in your hands. Keep learning,